A new strain of virus has brought the whole world to its knees. What is the coronavirus disease?
Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronavirus.
Novel coronavirus is the provisional name given to coronavirus before a permanent name is decided upon.
Where did this virus originate from?
The new coronavirus, which is spreading all over the world now, is first reported in Wuhan, China, in 2019 December.
COVID-19 affects different people in different ways.
What is an epidemic?
An epidemic is a disease that spreads to a small number of people in a place or a location. An example of an epidemic is London flu.
Is the coronavirus disease a pandemic?
Pandemic is a disease that spreads to a large number of people in multi-countries and multi-continents. An example of a pandemic is COVID-19.
The disease caused by novel coronavirus officially has the name as COVID-19. In choosing this name, the World Health Organization just specified on the type of virus that can cause this disease.
Countries like USA, they suspect that it is a leaked bioweapon made by China in a virology lab at Wuhan.
The Director General of World Health Organization clearly states that CO and BA stands for coronavirus, D stands for disease, 19 stands for 2019, the year first cases were seen.
The majority of the people who are affected were worked or shot in a wholesale seafood market at Wuhan, which also sold live and slaughtered animals. So the experts suspect that the virus affected human beings from an animal host.
The word coronavirus refers to the family of virus that can cause respiratory infections.
Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment.
Most infected people will develop mild to moderate illness and recovery without hospitalization.
A majority of the people tested positive for COVID-19 do not show any kind of symptoms. They are asymptomatic. But a few of the COVID-19 patients may show symptoms.
It is estimated that about 45% of people who contract COVID-19 will have no symptoms. This is one of the biggest challenges regarding the virus.
People with COVID-19 generally develop signs and symptoms.
What are the signs and symptoms of COVID-19 infection?
Most common symptoms are fever, dry cough, and tiredness.
Sometimes some of the other symptoms may also the patient may experience. One or few of the symptoms may also be experienced by the COVID-19 patient.
Less common symptoms are aches and pains, sore throat, conjunctivitis and headache, loss of taste or smell, and rash on skin or discoloration of fingers or toes.
Got mild symptoms, one or few mild symptoms that I have mentioned, may undergo home quarantine and the disease symptoms may subside on its own. Sometimes the COVID-19 patients may get serious symptoms.
Here, serious symptoms are difficulty breathing or shortness of breath, chest pain or pressure, and loss of speech or movement.
Therefore, when the patient is experiencing serious symptoms, he has to get himself admitted in a hospital and undergo medical treatment.
Medical attention if you have a serious symptoms.
Who is at the risk of COVID-19?
The virus that causes COVID-19 infects people of all ages. However, evidence to date suggests that two groups of people are at a higher risk of getting severe COVID-19 disease.
Older people and those with underlying medical problems are more likely to develop serious illness.
Those with underlying medical conditions such as cardiovascular disease, diabetes, cancer, asthma, and blood pressure.
As we get older, the risk of severe illness from COVID-19 increases, and the children are also at a high risk of contracting the virus.
These two categories of people are not having immunity in their body to fight against the virus which causes COVID-19 disease.
The aged and the children should take proper care.
Can people without symptoms transmit COVID-19?
This is clear that people without symptoms have the ability to spread the virus to others. It really depends on how the viral load is in your body.
How to get rid of this dangerous coronavirus?
Stay safe by taking some simple precautions such as physical distance, wearing a mask, keeping rooms well ventilated, avoid crowds, cleaning your hands and coughing into a bent elbow or tissue.
If you are experiencing symptoms or had the virus, the best advice is to continue, wear a face mask, be diligent about social distancing, don't attend large gathering, wash your hands frequently.
Who are frontline workers?
In hospitals, clinics and homes around the world, the frontline workers are taking on significant personal risk without adequate equipments to ensure our life.
To feel safe at home, because some have chosen to step out and be brave. Here's to the doctors, the police force, the shopkeepers, and the sanitation workers for risking it all. And to the journalists and newspaper vendors for holding strong to their posts to bring me the truth when it matters the most.
We thank the frontline workers for their service.
Thank you.
Thank you. Thank you.
Thank you.
On behalf of the teaching community, I salute the dedication of the frontline warriors. Stay at home and stay safe.
Stay at home, stay safe.
Unless necessary, do not step out of your house.